Okay, in this video, I'll be doing a heel stick, feeding the baby, bathing and diapering the baby, and weighing the diapers. Okay, so the first thing I'm gonna do is bathing and diapering the baby. So you want to check the baby's temperature and make sure that the baby's temperature is at 37 degrees Celsius. If you can, you want to bathe the baby at the radiant warmer, or if not, you want to pull the radiant warmer close by you to a sink. Okay, so the first thing you want to do, you want to you want to have your warm water ready, and you want to make sure any area that you're cleaning, you keep exposed. Any other areas you cover up. So the first thing you want to do with a clean cloth, you want to wash the eyes, and you want to wash the eyes from the inner canthus to the outer canthus. And you want to do both eyes, making sure you use a clean portion of the towel. And every time you wash a section, you want to clean the towel out. Then you want to wash the rest of the baby's face, and then you want to dry the baby's face. You want to dry each area after you wash it. Okay, after you do that, you want to any clothing on the abdomen, you want to go a downward motion. You want to wash the chest and the abdomen. You also want to do the neck first, and make sure you get under any folds of the neck, and go down to the chest, on the abdomen. And you want to like I said, each section that you do, you want to rinse your towel out, and make sure that you're using a mild soap when you're doing this. Okay, so then you want to dry the area, dry the abdomen and the chest and under the neck. Then you want to wash the diaper area in the back. And then you want to wash, well, before you do the diaper area, you want to wash the back and the extremities, and then you want to do the diaper area with it being last. Okay, like I said, each area that you wash, you want to dry that area really good. And once you finish bathing the baby, you want to put a t-shirt on, put a diaper on the baby. And before you put your cap on, when you're washing the baby's head or the hair to get any rest of the blood, you want to hold the baby, if you're at a sink, you want to hold the baby in like a football position, and make sure you hold the head. You want to use a mild shampoo, and with warm water, you want to wet the hair. And then you want to use a small bit of shampoo and work it in. You can also use a baby comb to, help get the any blood or vernix that's in the hair, to release it. And then you want to rinse it. And then you want to dry the hair, hair really good. And then you want to put a cap on the hair. If the baby's temperature is still good and at 37 degrees Celsius, you want to properly close the baby, t-shirt, diaper, hat, and you want to swallow the baby with a blanket, and then you could put the baby in an open crib. If the baby is too cold, then you want to put the baby under the radiant warmer. Okay, so the next thing I'll do is diapering the baby, since we're doing this. Okay, so we're gonna pretend like the baby already have a diaper on. So we're gonna pretend like the baby have a diaper on. Okay, this is my diaper. Okay, so okay, the baby has the diaper on. How can I see? Trying to see. Okay, the baby has the diaper on. Okay, so what you want to do when you're removing the diaper, you want to remove the Velcro on the side, and then you want to pull the diaper down. And as you're pulling the diaper down, you want to use the diaper as your, like, to clean the baby. So you want to clean the baby going downward. You want to clean the baby. And when you lift the baby, you want to lift the baby with the two legs. Sorry, I'm trying to do this with one hand. Okay? And you take the diaper off. Sorry. Okay, you take the diaper off. I wonder if I have something that I can see. I don't have anything that I can see. Okay. Now, when putting the diaper on, okay, after you clean the diaper, you want to fold the diaper up into itself. Okay, then you want to get a wipe and you want to wipe the baby with the wipe. If it's a little girl, you want to make sure you go front to backward. Okay, so you clean with the wipe, you folded the diaper into itself and put it to the side. Then you want to get your new diaper, and when you're putting it under the baby, you want to grab the baby two legs, and you want to place the back of the diaper under the buttocks. Okay. When you're looking at the diaper will have words on it. When the words are the front of the diaper, so that lets you know that goes into the front. Okay. So after you do that, I'm trying to see. You can see. Okay. So after you do that, okay, you want to bring the diaper in between the legs. Okay. And if the baby, umbilical cord is still attached, you want to make sure you fold the front and make sure you fold under the umbilical cord. You want to make sure you fold under the umbilical cord. Then you straighten out the front, and then you get the Velcro and you place it over, making sure that it's snug but not too tight. Okay. And then that concludes of bathing and diapering the baby. Okay, that one's done. Okay, the next thing we're gonna do is we'll do the heel stick. Okay, so with the heel stick, you want to obtain the doctor's orders. I forgot the starting part. When doing these procedures, you want to introduce yourself at the beginning, you want to introduce yourself to the patient. You want to get the patient's permission. You want to explain the procedures, let them ask questions. You want to provide for privacy. You want to wash your hands, and you want to place gloves. You want to change your gloves after every, wash your hands and change your gloves after every procedure. Okay, so now we're going into the heel stick. We'll look at the doctor's orders, okay? And we'll look at the doctor's orders, and with the heel stick, you want to make sure you warm the baby's feet. You can use a warm, moist towel, or you can use heel warmers, and you set that on there for 3 minutes. But you want to be careful for that to make sure that you don't burn the skin of the baby. Okay, so now that the baby's heel is warmed, you want to make imaginary lines, okay? So the first imaginary line will be between the 4th and the 5th toe. And you want to you want to do it parallel, lateral aspect of the foot. So you're basically going to come down like this. And then you want to do one in between at the great toe. And you want to come down kind of like you're making a V. And it's basically, you want to do it on the side portion of the heel, and you make the imaginary lines to make sure that you don't hit a nerve. Okay, so now that you have your imaginary lines and you pick the area that you're gonna go, you're gonna clean the area with 70% alcohol, and you're gonna let it air dry. If you use excess of alcohol, you can wipe some of the alcohol off or whatever. So you've clean the area with your alcohol. Okay, then you want to get the heel stick lancet to make sure that you get a smooth, clean cut. Smooth, clean cut when you're doing it. Okay, so you want to puncture the heel with the lancet. Okay, and you want to have a sterile gauze because your first drop of blood, you want to clean it. You're not going to use the first drop of blood. So you want to get the second drop of blood. You want to make sure that it's a large drop. And this is when you'll collect your specimen from the large drop. Okay, once you've collected your specimen, you want to put pressure with a little bit of gauze, and then you want to put a bandage on it. Then with your specimen, you're going to label your specimen, and you're going to take it down to the lab, and that would conclude you doing the heel stick. Then you want to discard of your gloves and get rid of that. So the next thing that I'm going to do is feeding your baby. Okay, so with feeding your baby, you want to position your baby. Okay, if you're right-handed, you want to position, you'll feel more comfortable with positioning your baby in your left arm or whatever. So you can position the baby like this in your left arm, in the crease of your arm. You want to make sure that the head is straight going with the body. Okay, if your baby doesn't like to be in this position, another position you could do is with the baby sitting this way and the baby leaning back on your chest. Also, you can do it another way where you prop your feet up and the baby is sitting on, head is sitting on your knees, propped like this. And whichever position, like I said, you want to make sure the baby's head is positioned. Okay, so once you found your position that you want, you have your bottle. Okay, and you might have to strike the baby's mouth or tongue to get the baby's attention. Okay, you want to place the nipple of the bottle in the mouth. And you want to hold the bottle at an angle to make sure that the bottle's nipple is always filled with milk, so that the baby doesn't drink any bring any air. Bring in any air. Yeah, okay. So while you're doing this, while you're doing that and the baby's, feeding and sucking, if the baby's awake and the eyes are open, you want to use this time to bond with the baby. You can talk to the baby, things like that. Also, you want to watch the baby while the baby's eating. If you notice that the baby is gasping or getting too much milk, then you might want to change the flow of the nipples. If you're seeing it's too much milk, then you would get a nipple with a slower flow. And if you see the baby is working too hard to get milk, then you want to choose a nipple with a faster flow. And you would increase the size of the nipples. You would increase the size of the nipples as the baby get older. Okay, once every 2 minutes that the baby is eating, have been eating, then at that time you want to burp the baby. So you'll hold the baby over your shoulder and you want to pat the baby on the back to help the baby with the burping. Okay, and after you finish that, you want to make sure you document how much the baby has eaten, how many ounces that the baby is eating, how many ounces the baby has eaten. Okay, and that concludes feeding the baby. Okay, and the last one that I'm going to do is the weighing of the diapers. Okay, so you have your diaper, that you folded up. Okay, and you want to go into the room where they have the diaper scale. Okay, so the first thing you want to do, you want You want to make sure the scale is clean, and then you're going to put a barrier over the scale and make sure the scale is at the zero. So you want to weigh the weight of the diaper, of a clean diaper, so you can get the weight of the diaper. Once you've got the weight of the diaper, then you want to place the soil diaper on the scale and get the weight of the soil diaper. Once you get the weight of the soil diaper, then you want to subtract the weight of the weight of the soil diaper from the weight of the clean diaper. Okay, and once you get that accurate weight, then you want to make sure you document. Okay, then you want to get rid of the soil diaper in the area where soil diapers go. You want to clean the scale, and then you want to do hand hygiene, take off your gloves, and make sure you document. And this concludes this video.